I'm Dolores Subia Bigfoot. I am enrolled in the Caddo Nation of Oklahoma. I also want to acknowledge and recognize the Northern Cheyenne tribe of Montana, in which my children are enrolled, and which I recognize as being the foundation for my children to recognize and to identify and to know who they are as Statista, our Cheyenne people. I'm also the director of the Suicide Prevention Resource Center and have enormous interest in suicide prevention. Let me go ahead to the next slide. Just to recognize the interest, the desire, the understanding that we need to have more conversations about suicide. So I'm grateful for the National Academy of Science, Engineering, and Medicine to start this discussion. I think we have had ongoing discussions, but let's continue having conversations. And so this first webinar, and as we think about other activities going forward, that we are building capacity and building knowledge. So thank you. Next slide. This is our Suicide Prevention Resource Center. It is available to everyone. We do a lot of resource building, capacity building. We offer toolkits, online training, prevention models. There's a lot more. So all the work that all the suicide researchers, suicide implementators, the interventionists, all of those things, if we are able to host them on our Suicide Prevention Resource Center, then they're distributed out to the community at large. We want to make sure that people are aware of our SPRC website. Next slide. And just to let you know that we are following the National Strategy for Suicide Prevention, and that diversity, inclusion, equity, and justice really guide our mission. So we want to make sure that we are promoting the ability of everyone to have access to services. Next slide. I just want to share with you the toolkit. So as we think about implementing zero suicide in Indian country, there are resources there. Next slide. The Suicide Prevention Resource Center finished up the first tribal needs assessment for 2022, and we will be distributing the results soon. What I want to identify is that we contacted almost every federally recognized tribe. We got 200 emails confirmed for contact individuals who identified as the suicide prevention person at that tribe. We distributed those 200 tribal needs assessment surveys to all those tribal contacts and received back 40 completed surveys. So we will be disseminating the results of the survey in April. We'll be also doing this on a regular basis every 2 years. So we're hoping to have more information as we proceed forward. One of the things that the tribes said as a result of this need survey is the need for more data, the need for better understanding that data, and how does it compare with other, local efforts? How does it compare with state efforts? So, the tribes are interested in using data, and it's not unusual, I think, that when we think about data, we have always had historically, tribes have always used information to guide their next steps, whether it was with, counting how much, buffalo hides they need for the winter, or how much, meat was preserved. So understanding how to use information current information for future efforts is not a new thing. Next slide. I also want to recognize the Commission on Native Children, which is also hosting hearings on mental health and especially on suicide. There was a March hearing on suicide in Indian country, and I'm a commissioner on the Commission on Native Children, and so I have several hats that I wear, but it's certainly overlapping. I think what we can see is that there's huge interest in how do we do preventive services and not get to the point where someone is thinking about suicide. Next slide, please. So what I want to talk briefly about is to think about our cultural-based knowledge that we can integrate into prevention. We know that our indigenous ways have always had transition points. This morning, prayer, that is something. So understanding how important tradition is. There's rules, we do gift giving, we do coming of age ceremonies, naming, all of these things recognize that transitional part. And I think that if we could utilize some of the cultural teachings that we have in this preventative effort, because especially with COVID, this is a huge transition with loss and grief and adjustments in terms of academics and being able to manage in pretty high stressful situations. How do we build into our programs the understanding of this cultural knowledge of how transition periods are important? Next slide. The other part is, that we have a lot of understandings about belonging, identity, connectedness, and circles. So I'm not going to read all of this, but we practice the principles of the seventh generation, paving the way for those yet unborn, but know that those prayers are important. Embracing extended family relations. How do we utilize adopting and taking our relatives, that inclusion, acceptance, and welcome, which is part of a lot of the efforts that we're doing as we think about just the diversity, inclusion, equity principles. So there's a lot of cultural teachings around belonging, identity, connections, and circles that we can incorporate into our suicide prevention programming. Next slide. So that sense of belonging is important, and the thing that we can see is that it lessens stress, reduces anxiety, increases the sense of purpose, and that generational connectiveness. So next slide. Next slide. And when we think about, what is it that is helpful as we consider these cultural teachings, one thing is about ceremony. What is it for? It's about preparation, sacrifice, service, reflection, offerings, grounding. All of those things resulting in self-regulation. And, when we think about that self-regulation, self-discipline, it's about controlling, about discipline in terms of one's behavior, emotions, and thoughts. And so the ceremonial aspect in terms of what is going on is one thing, but the individual's behavior, thoughts, and understanding allows for that sense of self-discipline. So as we think about cultural teaching, we can think, how do we integrate these things into the prevention effort? And next slide. So again, another cultural teaching, and I'm sorry that Dan Foster isn't here. One of the things about the Blackfeet cultural teachings is the respect and the understanding about silence. So what is silence? It's that pause, it's that time for reflection. And we want individuals who are anxious, who are impulsive, who are thinking about harming themselves to have that pause, to have that ability to separate, those intense feelings and be able to pause both in thinking and feelings and in behavior. So not act immediately. We see this a lot in the speech cadence, having that thoughtful response, and also comfortable with silence, comfortable with listening, comfortable with being present. So when we think about the cultural teachings that we have a lot of the grounding principles that allow for the prevention efforts to be built based upon these cultural teachings. So I really am excited about having conversations with researchers, with others in tribal communities about how to bring these cultural teachings into programming, because we keep reinforcing and hopefully keep saying over and over again that the answers lie within, that the answers lie within our communities, that the answers lie within our cultural teachings, that the answers lie within our ability to have generations of families that have been able to thrive. And how do we bring these cultural teachings into a more programmatic aspect so that they can be honored, can be uplifted, can be respected? So thank you.